I'm Dr. Kavitha Naragoni. I'm consultant gynecologist and obstetrician at KIMS Hospital. So today let us know about various conditions by which a female gets affected and their solutions. The first is the bleeding problem. So bleeding can be excessive bleeding, or it can be a frequent period with excessive bleeding, pain during bleeding, and intermenstrual bleeding. So this can happen. These menstrual irregularities or menstrual blood loss, excessive menstrual blood loss can occur in conditions like fibroid uterus or endometriosis, adenomyosis, and also in cases of cancers. So whenever you have such symptoms, you should consult a doctor. And after thorough clinical evaluation and investigations, we come to know what the exact problem is. So first, let us know about fibroids. So fibroids are the masses, are benign masses, that is non-cancerous masses, which can occur in uterus. It can be either single or multiple, and it can enlarge your uterus to a huge amount, like it can be a 9-month pregnant uterus. So when you have this, you have pain abdomen, you have menstrual irregularities and intermenstrual bleedings. So in such cases, we need to remove, depending upon the age, we either need to remove the uterus, which is called as hysterectomy, or just removal of fibroids, which is called as myomectomy. If we are removing fibroids, we cut open because these fibroids lie within the layers of the uterus. So we cut open that layer of the uterus and we remove the fibroids, and we need to resuture the uterus layers in situ, like with a good approximation, so that it has good strength, and when a lady conceives, it has to hold the baby without it getting disrupted or without the uterus getting ruptured. So we need a good surgical tool for this. This is called, the removal of fibroid is called as myomectomy. And the hysterectomy is we just remove the uterus by cutting all its attachments to the pelvic wall, that is all its ligaments to the pelvic wall. And the third thing is tubal recanalization. This is a different entity wherein when a lady undergoes tubectomy or a family planning surgery, sometimes in few cases, when they wish to have a child again, we need to resuture. In tubectomy, what we do is we cut both ends of the tube. We discontinue the tubes so that the egg and sperm don't meet and they don't become pregnant. But in tubal recanalizations, when a lady wishes to conceive again, we have to resuture these two ends. But the tubal opening is very, very small. So it is like a pinhole. So we have to approximate both the ends. For this, what we do is, we either do open surgery or a laparoscopic and robotic surgery. All these three can be done for all the above mentioned conditions like hysterectomy, myomectomy, and tubal recanalization. And there is one more condition called as prolapse uterus. That is, due to the weakness of the tissues, inherent pelvic tissues, the uterus starts descending into the vagina and it comes out of the vagina. Either we can do an anchoring procedure of the uterus, that is, we take the uterus up and suture it to the sacrum, or if according to the age, if hysterectomy is needed, we do a hysterectomy and suture the wall to the sacrum. This is called as sacrohysteropexy or sacrocolpopexy. So all this can be done by 3 routes, as mentioned earlier, either open method or a laparoscopic method and the robotic method. In open method, what we do is we cut open the abdomen by 4 to 6 inches, and we have 4 to 5 layers of abdominal wall. We cut all the layers, we go in, we handle the tissue with our hands. With the hands, the surgeon hands, assistant's hands, and all the nurses' hands go into the abdomen, and there is a lot of tissue handling. What happens is, with this lot of tissue handling, the pain is more. Post-operative pain is more, patient need to take more rest, blood loss will be more, and the rate of infections is also high. And there is a late risk of hernia also from this incision, from this big abdominal wound incision. And we resuture all the layers. So this is laparotomy or open surgery, what we call. And now, unless it is, this has become an obsolete, I can say, because everyone prefers to undergo a minimally invasive procedure. The minimally invasive procedure is through laparoscopy or robotic. So last 2 decades, We have been doing laparoscopic surgeries for all these procedures. Laparoscopy is also a good procedure wherein this large abdominal incisions are avoided. There are 2 to 3 small 1 centimeter incisions on the abdomen, and the tissue handling will be less. We handle only with the instrument tips, so there is no handling by the hand, so that the pain is minimal and the injury to the tissues is also minimal, and post-operatively the pain is minimal. So how this laparoscopy is different from this robotic? Now let us know about robotic surgery. Let us know how it is different from laparoscopic surgery, because both are minimally invasive. Both are associated with less than 1 centimeter incision on the abdomen, and we don't see a scar at all. But there are special advantages of robotic surgery than the laparoscopic surgery. Thing is, the instruments that we use in robotic surgery are very fine, finer than laparoscopic surgery. The dissection will be done in millimeters, millimeter by millimeter, and it is a very precise dissection. And the tissue handling will be much more lesser than laparoscopic surgery, so that the morbidity, that is the pain and tissue damage, will be very less in robotic surgery. And the camera and telescopes we use here give a good 3D vision. 3D vision and a wow picture in robotic surgery, wherein the magnification is 10 times, 10x, that is 10 times more than the open surgery and 4 times more than laparoscopic surgery. So the tip of the instruments also move in every direction possible, which is not possible with laparoscopic surgery. So we just do suturing and the dissection very easily. Suturing is especially needed in surgeries where good tissue approximation is needed, like in removal of fibroids. I told you that this removal of fibroid, after removing the fibroid, we need to suture the myometrium with a good approximation, so that it holds the uterus, the baby, while carrying. So this can be done, this good approximation is got with robotic surgery, because we can do a good suturing job with robotic surgery. And even tubal recanalization, that is reversal of tubectomy surgeries, will be done very well by this robotic system, and also sacrocolpopexis. So overall, robotic surgery is a boon to both to the surgeon and patient. Why surgeon? Means we are at comfort, we are doing under good magnification with a 3D depth perception with highly sophisticated instruments, so that we can offer a good skill onto the patient tissue, which automatically directly that benefit gets transferred to the patient. So the post-operative pain is very less, so they are ready for discharge on the second day, and the blood loss is almost nil, and they can go back to work on third or fourth day, even after a major surgery. If you have any doubts regarding this robotic surgery or any other minimally invasive procedures, to know the difference between laparoscopic and robotic surgery, how robotic surgery is going to help you to have a better health and better childbearing, you please visit us.